Infection control
refers to measures taken to prevent the spread of infectious diseases in healthcare settings, communities, or other environments. This includes practices such as hand hygiene, sterilization of medical equipment, vaccination, isolation, protocols, and proper waste disposal. The goal is to minimize the transmission of pathogens and protect both patients and healthcare workers from infection. An example of infection control is regular hand washing by healthcare workers before and after patient contact to prevent the transmission of bacteria and viruses between patients and staff. Reducing the risk of healthcare-associated infections is extremely significant in dentistry to prevent the transmission of diseases between patients, dental, healthcare workers, and the broader community. Dental procedures often involve direct contact with saliva, blood, and other bodily fluids, creating opportunities for the spread of pathogens. Without proper infection control measures, there is a risk of transmitting infections such as HIV, hepatitis, and other bacterial and viral illnesses. Therefore, strict adherence to infection control protocols, including sterilization of instruments, use of protective barriers, and proper hand hygiene, is essential in dental practices to ensure patient safety and maintain public health standards. Infection control and microbiology. Both fields involve an understanding of microorganisms, including bacteria, viruses, fungi, and parasites, and their characteristics, behaviors, and modes of transmission. Disciplines focus on preventing the transmission of infectious diseases. Microbiology identifies the pathogens responsible for infections, while infection control implements measures to prevent their spread. Both fields emphasize the importance of hygiene practices in controlling the spread of infections. Microbiologists study the effectiveness of disinfectants and antimicrobial agents, while infection control practitioners implement these agents in healthcare settings and other environments to prevent infections. Both infection control and microbiology involve the use of sterilization and disinfection techniques to eliminate or reduce the microbial load on surfaces, medical equipment, and instruments, thereby preventing the transmission of infections. Both fields have a significant impact on public health. Microbiology provides the knowledge base for understanding infectious diseases, while infection control implements strategies to protect populations from the spread of these diseases. Both fields have a significant impact on public health. Microbiology provides the knowledge base for understanding infectious diseases, while infection control implements strategies to protect populations from the spread of these diseases.
Now we are here at Southwestern University, Kenya, to discover the importance of microbiology and environmental transmission.
Understanding microbiology is crucial for comprehending how diseases are transmitted and how to prevent their spread. Microorganisms, also known as microbes, are tiny living organisms that are invisible to the naked eye. They can be found everywhere and in the environment, including soil, water, air, and the human body. While many microbes are harmless or even beneficial, some can cause diseases such as COVID-19 pandemic.
transmission during touching, kissing, or sexual contact. This includes touching the doorknobs, utensils, shared equipment, or any contaminated surfaces without infection control. So, let's talk about the droplets transmission. This transmission occurs when respiratory droplets containing infectious agents are expelled from the infected person's nose or mouth and are inhaled by a susceptible individual. This typically occurs within a short range, such as an infected person's coughs or sneezes. Airborne transmission. So this transmission occurs when an infection agents are suspended in the air and can be inhaled by a susceptible individual over long distances. This can happen with pathogens that remain airborne for extended periods, such as tuberculosis bacteria or measles virus particles. Bone transmission. So this transmission is when disease-causing microorganisms are transmitted to humans through a bite of an infected vector, such as mosquitoes, ticks, or fleas. For example, this includes malaria transmitted by mosquitoes and Lyme disease transmitted by ticks.
us talk about the importance of understanding transmission. First is we have the targeted intervention. Understanding how diseases are transmitted allows the implementation of targeting interventions by preventing transmission. For example, hand hygiene practices can help prevent the spread of diseases transmitted through indirect or direct contact. Secondly, infection control measures. Knowledge of transmission modes informs the development and implementation of infection control measures in healthcare settings, including the use of PPE, isolation precautions, and environmental cleaning protocols. Thirdly, we have the public health intervention. Understanding transmission modes guides public health efforts to control the spread of infectious diseases within communities. This may involve vaccination campaigns, vector control strategies, or public health messaging to promote behaviors that reduce transmission risk.
To summarize everything up, a basic understanding of microbiology and disease transmission mode is essential for effective disease prevention and control by recognizing how diseases spread. Healthcare professionals, public health authorities can implement targeted intervention to reduce transmission risk and protect individuals, communities, from infectious diseases.
So now we already know the importance of microbiology and disease transmission. This is very helpful in dentistry field because we already know that dentist deals with extensive oral microbiota, which plays a significant role in our oral health and disease. Understanding the type of bacteria that is present in your mouth and interactions and their impact on the oral health that help dentists to diagnose and treat the various oral conditions effectively. Also, dentistry involves a procedure that can expose the patient and dental health worker to infections microorganisms. Knowledge of microbiology is essential for implementing proper infection control and protocols to prevent the spread of infection to the dental office. In preventive dentistry, which is part of the microbiology and disease transmission that we already help in the dentistry field, microorganisms such as bacteria and fungi, it contributes to the formation of dental caries, which is tooth decay, and periodontal disease such as gum disease. Understanding the microbiology of this disease enables dentists to educate the patient about the preventive measures and design the target preventive strategies. Understanding microbiology and disease transmission is very helpful to dentistry, especially in treatment planning, because we all know that microbiology informs in treatment planning in dentistry, because dentists needs to understand the microbial pathogens that involves in various oral infection to choose appropriate antimicrobial agent and treatment modalities for their patient. Also, it could be about the emerging infection because dentistry students must stay updated on the emerging infections, on the diseases, and antimicrobial resistance pattern. Knowledge of microbiology helps dentists to identify the response to new infections materials or infection traits effectively. In summary, microbiology provides dentistry students with the fundamental knowledge and skills that is necessary to diagnose, treat, and prevent oral disease while ensuring the patient's safety and well-being.
So now that we have discussed the importance of microbiology and disease transmission, whenever you hear the word germs, do not feel overwhelmed. Remember, microbiology is about harnessing knowledge and building a better future. And that's a pretty amazing job.
So that would be all. Thank you for watching our video. I hope you liked and learned from our discussion about infection control that could be related in microbiology and disease transmission. So if you have